The only other thing that I'll add is, and maybe Bryce, you can throw that in the chat box. We take all of our notes during this meeting in the Google Doc, the shared Google Doc. And so that's where Bryce is taking his notes, and you can look at that at any point, either today or anytime after today's meeting. So anything else, Bryce?
I don't think so. Yeah, I'll throw that in the chat right now. So as we're adding things to it, I'll be sharing my screen throughout today's conversation. But if you guys feel like I'm going too quickly, or you want to go back and look at a separate strategy or tactic that we covered in our last meeting, or maybe earlier in this meeting, feel free to go into this Google Doc. So there we go.
Okay, so we only got through, we are doing the prioritization of tactics for each strategy based on how the strategy was prioritized. And so we made it through strategy 3 and 7 last time because they were the top 2 rated strategies. So we're going to start off. Oh, I guess there was one that we didn't get to for strategy 7. So I think that's where we're starting off today. Is that right, Bryce?
Yeah, so we covered 3 and 7, but as you guys can see, I added this at the last minute during the last meeting. We didn't vote on one of them, which was encouraging communication between medical professionals and coaches to ensure safe outcomes during play. So we can do that now. If you guys want to enter that same code or just go into your previous browsing window, we just want to have a breadcrumb trail to have all the voting from each of the tactics and strategies. So,
and just as a reminder, strategy 7 is coaches, game officials, parents, and caregivers should create safe and inclusive environments for sports participation that promote physical activity and health for youth and adult participants. So that's the overarching strategy.
And 8 responses. Let's see if there's a couple more on here. 9. All right, maybe one more. Robin, did you vote?
Yes, I did.
Sounds good. All right, we'll give about 10 more seconds, and then we can move on to, I think we're going to do strategy 4.
And I guess the other instruction that I would give you is, as in addition to ranking the priority of the tactic, we want you to consider 2 other questions. And those are, does this need to be tailored more for our region? And is this already being done in our region by some other organization, some other entity, some other program? So it looked like this.
So you can kind of compare, you can see where that fits into our voting last month on this strategy 7, kind of probably the lowest one out of all of those, which kind of makes sense based on the conversation that we had. And if you want to review that conversation, feel free. You can go into that Google Doc, go to strategy 7, and then read through those associated tactics in that conversation. So on to strategy 4. This was one of our top 3 priority strategies, and it outweighed the rest pretty handily. So this one is, sports organizations should adopt policies and practices that promote physical activity, health, participant growth, and the development of physical literacy. So this is where it fell in our Red Cap survey on implementation locally and its ability to improve health. So it was right up there with strategy 3 as the highest to improve health, maybe a little bit more difficult to be implemented locally, but that's why we're talking about it. So we can gain a little bit of insight from the conversation that we had in the National Youth Sports Strategy Kansas City meeting. And this will just kind of be some thought stimulating ideas We covered policies to promote the importance of sport. So if we start at the top, we can look at some of the highest impact ideas. So cross-sector collaboration around physical activity and its benefits, continue to gather research and information to go after grants and sponsors, creating a Kansas City Youth Sports Alliance, to create a comprehensive list to send messages to, community events to raise awareness and money. We have establishing mass media strategy of KCPA, engaging experts in cross-sector work to create a consistent message. This is a good example of the potential for this group, if we continue meeting into the future, for cross-sector collaboration and potential projects into the community, and even policy change. So we do have a newly created mass media sector that would be crucial to covering this aspect if we chose that to be a priority for ourselves. In the middle, we have using technology to create opportunities and increase access. Here's some more digital content. Social media is down here, which these three are pretty easy to do, but maybe low impact, creating micro funding grants, and then another research and evidence-based data. So let's keep these in mind as we continue this conversation and we vote on the tactics. But first and foremost, let's vote on these so then we can talk about them individually and we can see where they rank from one another. So we'll go back to that Mentimeter 36420580. And remember, this is going to be a 5-point scale.
Regarding the fourth tactic, embrace developmentally appropriate forms of play through frameworks such as the U.S. Olympic Committee's American Development Model. I wasn't familiar with that, so I had looked this up earlier today, and I pasted a link to the hockey American Development Model framework, and that's in the link that you see there. And basically, they have 8 different stages to engage youth into hockey. So it starts out with 6 and under. That's where you're just learning to skate and having fun. And it progresses, of course, like learning how to train, learning different skills, learning how to compete, things like that. So that's what the American Development Model is. I know that there are, I don't know if there's models for every Olympic sports, but I found them for hockey and golf in my search today. So if anybody else has any other information, feel free to share. But
all right, we'll wait for a couple more responses and then we can get started with the conversation. All right, in the meantime, we can start talking about, let's start talking about tactic 1. So strategy 4, tactic 1, let me know if you guys can't see this well enough. I can zoom in farther, or like I said, you can open this up on your computer as well. All right.
Bryce, could you go back to the results real quick?
Sure.
Yeah, so it looks like the top, there were clear top 3, and then the developmental model was clearly like a 4th lagging one. I guess I'll just open it up to any points of discussion about these tactics. I would just say, I think it came up in the youth sports workshop, and maybe in some other side conversations I've had, that while people like Amanda and Joey and I, we really love a good moderate to vigorous physical activity focus, but that's probably less important for most parents and families, is my perception. And
I think additionally for tactic one, there's obviously a variety of sports that even at the Olympic level, we saw a lot this year that maybe aren't in that moderate to vigorous physical activity realm, that still take, a large mental capacity. They, build team building skills. It's still really imperative to improving health and learning. So.
are there any
Shooting,
rifle shooting? Yeah, that's a good one.
correct.
Are there any examples of any of these things that are currently being done as like model programs within our region? I think I mentioned this before. I've seen some a similar program for the second tactic, where the Kansas City Royals, they reward good coaching practices. They give coaches who get this award. I think they award someone monthly a good coaching award, and they get free tickets to the game or something. I don't know if there's any similar examples of recognition for organizations that modern inclusivity or serving underserved populations.
Do you want just local examples, Robin? Or are you looking for?
Yeah, I guess either. Yeah, either.
Well, there's an organization called Up to Us. I don't remember if we've talked about them, but they focus almost entirely on getting more coaches into youth sports, like trained coaches, and actively training them so that they're not just, not that there's anything wrong with this, but that they're not just parents that are like, nobody else is doing it, I'll do it. So they're actively, and they actually have, I think, almost like a fellowship program where they will hire a fellow to go into a community to serve as a coach as a part of their program.
That's good. And they're national.
Mm-hmm.
And we don't know if they're necessarily local.
I had a call with them earlier in the year, and I want to say they didn't have anybody necessarily serving here, if I remember correctly, but they were we were looking to try to leverage their partnership with them to try to get more coaches around our camp in the summer for next year. And I want to say they're affiliated with AmeriCorps, but I might be confusing them with something else.
Okay.
Maybe City Year, one of the two.
Gotcha.
Hi, this is Anthony Trakus.
Hi, Anthony.
Hi. So I work at the Whole Person, and on Tactic 2, we just had awarded KC Parks and Rec for their inclusive sports programming. It was mainly like archery and another one. And then we awarded Dr. Fisher an award. And so those two.
Great. Was that kind of like a one-time thing or an annual thing that you give this award, or is this something that you do kind of on a regular basis?
It's an annual thing. So it's like in conjunction with our year-end fundraiser.
Yeah, that's great.
I know this is Jay Robertson, supporting Kansas City, their Victory Project charity. Part of their mission is to make soccer accessible for all, especially underserved and underprivileged students. So I'm sure they would be willing to help with that, make something out of it.
Thanks. This is something that I've never figured out yet, is exactly what the Victory Project does. So that's helpful.
Yeah, I
So-
think they kind of focus on raising money for children's cancer, but also part of it is to make soccer accessible for all. I mean, it's
Yeah.
kind of
this
it's to promote child well-being, I think, is their main goal. But those are two of the big pieces of it.
this is Anthony again. They partner with us in a power chair soccer program that runs out of one of the community centers. But yeah, they're a great organization, and it was, I think, came out of trying to reach urban youth and promote soccer, and then they've kind of expanded into like all abilities.
Great, thank you.
And I'm friends with the leaders of that organization. If you want them to be involved, I can give you their contact info.
Excuse me, with the Victory Project?
Yes.
Okay, yeah, that'd be great. I know we did engage with a couple people from Sporting KC, their community programs. I don't believe they've joined us though for any of the sector meetings, so that'd be great. Okay, any other discussion points on any of these tactics?
I think the third one is really, I mean, it aligns so well with so much of the national research, right? Even the National Youth Sports Strategy, but also the Project Play research around sport sampling. And I think a subset of this tactic is not only establishing pricing models and season timelines, but I'm not exactly sure if it's like a public awareness campaign or what, but there has to be a mindset shift in parents, right? Like the idea that my kid's going to get a scholarship to play sports, and so I'm going to have them specialize and only play that sport all the time because that's the thing they're going to get a scholarship in. That mindset and thinking has to change.
Yeah, thanks for bringing that up. And it aligns with a conversation that I had with a 13-year-old that is from, I guess, somewhat disadvantaged household, exactly the type of person that I envision we need to try to meet. And he loves all sports. He only is going to play basketball. He says it's because that's the one that he can get a scholarship in, of course. But I think that if I would talk to his parents, there might be other things going on for why he only does participate in basketball during basketball season. And I think that probably has something to do with the pricing or accessibility. And so I'm just kind of curious what, how something like that plays out in practice. Is it something kind of like what we talked, I think it was last month, with KCPA Parks and Rec about their sports leagues that are offered all year round, that are affordable, or what, what, I guess, what exactly is it beyond this tactic? Is there more information or more objectives we need for this tactic, or no one knows?
I mean, I think this, and then I'll stop hogging the mic, but I feel like it's somewhat speaking from anecdotal example and not necessarily being able to point to having empirical evidence that says, because I think that there's the pretense, right, that there's the two ends of the spectrum. There's the kid that you're talking about, Robin, that's like coming from limited resources and has to prioritize based on what's available to them, both on opportunity and what resources are available to them. And then there's the kid on the other end of the spectrum who has a lot of access to resources and opportunity, and still the outcome is, I don't want to play sports anymore by the time I'm 13 or 15 because I've been pushed to specialize at such an early age. I think that if we had some broader local data to point to that says, okay, in these areas of our community, and as it relates to these particular demographics, opportunities are amass, and the impact and reason that kids are dropping out of sports is X, versus in this area of the industry sector, and I'm not saying geographic area, but like, then the reason that kids are having to prioritize or drop out is because the opportunities aren't there, they're not affordable, et cetera. Like, I think most of this is when I feel like we've had these conversations with the HHS group, and in these conversations, it's mostly all of us saying, well, I talked to so-and-so, or I've had this conversation with these parents, or I've had this conversation with the kids that I coach. And there is no sort of empirical point to that says like, this data tells us because we know that XYZ is true about our region.
So, yeah, so I thanks for bringing up data and surveillance. Jessica and I were talking about this a little bit earlier today. So that I think that that's a really good point, and I think we're going to dig in a little bit deeper on that in strategy 6. So we'll kind of put a pin in the data piece and see if anyone has any other comments.
Come back to see if we
Okay.
had any voting last week on a tactic that, you know, had similar ideas to this one.
Well, actually, maybe Bryce, if you could go, let's move on from strategy 4, and maybe can you go, are you able to go to strategy 6? I know that's a little bit out of the order.
Sure, absolutely.
And that's the one I believe where we're dealing with surveillance.
Awesome.
That's a nice segue
six.
here. Okay, so strategy 6, as if you recall from the rankings for improving health and implemented locally, was not rated as high as some of the others. This is public health agencies in collaboration with sports organizations should develop and implement a comprehensive surveillance system for monitoring sports participation in all segments of the population. I would just kind of clarify to this that I don't think it necessarily has to be public health organizations that are doing this surveillance. That's traditionally where it's done, but it can be done in other places. So just 2 strategies for strategy 6. Or 2 tactics, excuse me. Okay, so the two tactics are develop and implement a plan for establishing a comprehensive surveillance collaborative for sports, physical activity, and health for all, and 2, create a survey tool that measures the overall experiences of sports. And so I think that this, I'm aware of, I believe, 2 current surveillance systems for sports participation. The first one is because I help administer it, is through Children's Mercy Hospital. We do a community needs assessment, and among those, the questions that we ask, there are a small number that are related to sports participation. We publish that information in our report card on physical activity for children and youth. So I threw that in the chat, and in summary, sports participation actually was the highest graded metric that we assessed. It got a B-, and that is because, according to the survey, 60.1% of children and youth age 5 to 17 played on at least one sports team in the past year. They also asked a question about the total number of sports teams that you played on. So 60% played at least one sport. Conversely, 40% played no sports. Now, that question is very crude because you can play on, one team and technically meet get a good grade for that in our region, but that hardly tells the whole story. And so while it received a B-, which was our highest grade, we made clear to point out that that this data was not telling the whole picture and that there were likely large disparities in sports participation. We don't have any other sports participation information from that survey. The second surveillance tool, and maybe Anthony can talk about this, is does the whole person, I know you have your surveillance tool, Anthony, do you talk specifically about participation rates in your survey or just opportunities and programs?
No, yeah, we're just really on like the first phase of kind of the initiative just being to increase participation. And then, our landscape's very fragmented. If you look at our community partners, there's a lot of different organizations that run special populations programming. So that's kind of like phase 2 would be to actually measure participation. We're just trying to encourage it at this point.
Gotcha. Okay, so are there any other current surveillance being done on sports participation in our region? Yeah, I didn't think so. So there's clearly a need, and Jessica and I were talking about this earlier today. There is national data available from a variety of sources. We can get some general trends nationally, which is not unhelpful. And there might be opportunities in future surveys, either from Children's Mercy, or it sounds like Anthony, about tracking actual participation rates. It sounds like, though, well, it's hard to tell from my perspective. I love data, so I think surveillance should be a priority for something that comes out of our work.
I would be curious if the school districts do that, and the youth portion, but then once you get to adulthood, I don't think that's done at all. I can think of like the government agencies like the Conservation Department and KC Parks and Rec, like keeping tabs on their participation, but I don't know about that being done in adult sports participation.
Robin, this is Joey. I'm just thinking that like things like corporate challenge, the names for all of those are public, and we can, if somebody had an intern or a, undergrad, like we do on our team, we could somebody could go through and, look at the participation over time. What is the participation year to year? Those kind of things could be valuable, but yeah, I mean, telling the whole story is going to be, that's a tough one. Garmin, maybe I don't know if we can leverage like Garmin data.
And yeah, I would highly recommend the government agencies tracking adult sports participation. like conservation department and KC Parks and Rec, they might have a view of this, already.
The Garmin data is interesting, or any other type of wearable device, I guess is what you're saying, maybe, Joey. Yeah. Does anyone know the American College of Sports Medicine puts out their American Fitness Index survey each year? Are you familiar with that? And they, rank like the fittest cities and things like that. And that's using a variety of data points. I honestly don't know what those data points are. My assumption is that it's only adult data and that there's likely no sports participation data in there. Well, the other point of this is, rather than just participation rate, is getting actual experience data, which is the second tactic, to figure out, I guess, whether people, children or adults, are enjoying their participation, or whether it's perhaps even driving them from participation if it's not enjoyable. Likewise, what some of those barriers to sports participation might be on like a family level, whether it's cost or transportation, or bad experiences with coaches, other teammates, things like that. Okay. Any other conversation around surveillance? I think, just something to kind of keep in mind is, I could talk more about this, but I think a good approach might be to try to get through these rankings, and then we can kind of piece all the findings together in the summary next month to say, okay, here's how surveillance might be connected to a central organizing entity, which could then inform, these things regarding affordability and access. So, okay, Bryce, I'll kind of leave it up to you to tell us what strategy we move on to next, since I've screwed up your order.
Yeah, no problem. Let's move on. We'll move back here to strategy 5. All right, so strategy 5, sports organizations should ensure that sports programs are conducted in a manner that minimizes risk of sports related injuries and illnesses. So I know we have a lot of sports medicine doctors and such in our sports sector. So I think that's part of the reason why it was one of which that rose to the top. There's also, obvious implications right now for bringing sports back during COVID, after COVID, with whatever else is coming in the future as well. Obviously, flu season's always interesting with group sports as well. So
yeah, this is a really interesting strategy because it receives high marks for implementation locally. So I think that potentially reflects the good participation we've got in this group from Children's University Sports Medicine. So.
All right, so if you guys want to go back to the Mentimeter, we'll get some data on this. We can vote on the 4 tactics of this strategy.
Okay. Couple clear, high rated or fairly high rated tactics, couple others that are a little bit lower. Any comments for discussion on this? Maybe we can start it out with, what things are currently being done locally, maybe related to any of these this strategy or any of the tactics. Or just any general comments.
This is Jay. I mean, tactic one, I think that goes back to that if we have a kind of governing body or some sort of organizing or certification standard or something that kind of takes care of number one. That's my thought on that. And then number four, I think the medical professional that we'd be talking about in most of those cases is actually an athletic trainer, and having athletic trainers around at large sporting events and, where lots of youth are around, just someone to run over and be present if something really bad were to happen, or also somebody for parents to run questions by in the moment too is good.
I'm not sure what all sports participate in it, but they have safe sport. I know like gymnastics and probably similar sports to that utilize it. And they investigate any claims of like unhealthy practices. I think that's related more to tactic one.
Yeah, that is a really good program, and they cover injuries, they cover abuse and violence in sport, all that kind of stuff.
And without knowing much about safe sports other than hearing it before, is it just set? It's an actual organization that investigates these things, and I guess, is that like a universal program? So like I could call and submit a inquiry or a request or something?
Yeah, I've actually gone through it with, I've been interviewed for Safe Sport before. Yeah, I don't like, they're definitely third party and they seem to take complaints from a variety of sports, but I don't know if like that sport kind of promotes and registers with them or not. But yeah,
I don't know
seek out.
specifically about them investigating claims or doing something disciplinary. I know from an education standpoint, there's stuff for athletic trainers, physicians, parents, and athletes and coaches to learn through them. There's curriculum and stuff that your organization could purchase or pay for. There's probably free stuff on there too. But we are looking into maybe having all of our athletic trainers and docs and nurses go through it at some point.
Well, along those lines, yeah, Jessica says her team gets certified in it. And $20 seems pretty reasonable for a certification. But there's clearly not like a standard, right? It seems like that, to be a coach, you've got to be Safe Sports certified or something like that.
For what it's worth, as far as actual injuries due to sports go, I think what we see that's truly preventable is mostly due to ignorance of overuse injuries and things like that. I mean, inevitably, some things are going to happen in sport, no matter how safe you make it. So I think it's kind of important to be ready when something happens more than it is to truly be overly worried about prevention of injuries, just because some things are going to happen no matter what we try to prevent.
And then just one other thing on safe sport. I think some other sport governing bodies may require the safe sport training as well. So I think like USA Gymnastics requires that those coaches get safe sport training type thing. So it's implemented in a couple ways.
They definitely do now. That was all after
Yeah.
the Larry Nassar stuff. Which that obviously something we'd want to prevent, and overuse injuries like throwing too much in baseball and stuff like that. Things that could be just a little bit of education. Sometimes you tell people stuff and they're like, wow, I didn't know my son shouldn't throw 100 pitches 3 times a week. So
Yeah, and this kind of fits in with the strategy 4, I guess it was, where we talked about, the developmental model, where different ages are introduced to different types of sports activities, whether it's, just fun, getting out and playing versus actual skill and technical development, things like that. Some of these things obviously are interrelated. And I guess Anthony had a good point. Yes, I do think COVID protocols probably fall under this. And I know, Pastor Roberson wasn't able to join us today, but he, and I'll mention this a little bit later in more detail, but their leagues where it got delayed by a week, and it sounded like it was potentially due to COVID protocols in the region. And so I don't know any more details about that, whether, like the health commissioner recommended delaying a week or something else, but okay, any further discussion on this item? And I guess, Children's Mercy folks, feel free to hop in with any additional information about specific programs or initiatives that you're doing or rolling out that are related to this.
sorry, there was one other organization I want to throw on there for the education and stuff for parents and coaches. There's www.stopsportsinjuries.org. It's the Andrews Institute. James Andrews is the guy who does all the professional ACLs and Tommy John surgeries and all that kind of stuff. And his group, they've come up with some really good kind of baseline injury prevention stuff for kids. Again, this doesn't really apply to adults, but yeah, it's a good website, easy for parents to navigate and kind of look up stuff for their specific kid and their sport and kind of age appropriate guidelines. Yeah, that is it.
Cool. Great. Thanks. This is very good. Obviously, if you're injured, you can't participate in sports. I've had a hip injury for 2 years and have never been more sedentary in my life. So injury prevention and treatment is obviously important. Okay, Bryce, we'll let you move on to the next strategy.
All righty. All right, so we'll move on to strategy 8. This is going to be sports organizations should use advances in technology to enhance the quality of the sport experience for participants. So I think initially in the ranking, it was fairly low, but based on this red cap, that we filled out. It's kind of, middle of the road for implementation locally and its ability to improve health. I think it's definitely on the up and up. I wish Bill was on this call. He's, obviously really big on this with his ready to play application, and he could probably touch on the benefits of that even more. And we can check that out. I'll send the link in the chat here soon. But we can vote on the associated tactics to strategy 8. So pull up those Mentimeters again.
So this is one that I kind of struggled a little bit with, just because I didn't really have an example of what an example of a technology might be. But then I was thinking, I use my Garmin and my Garmin Connect app, and periodically, like I use like the heat map to figure out where people are going on runs if I'm looking to mix something up. And I know that there are other examples of that where, and I never did it, but Strava, is that right? Was it Strava where people map the rides and things? So that's an example, I think, of how technology can be used to make people aware of opportunities. Now, those are all recreational activities. I don't necessarily know about sport-specific activities, but maybe I'm just too much of a Luddite to understand this better.
Yeah, and I think it's pretty broad. I mean, it would even encompassed in that is getting the word out if there's an open gym. I know, Hy-Vee and Woody have probably tried to implement a lot of those things with coordinating events and such. There's also, applications for specific sports. Like if you didn't have a watch or a stopwatch and you were coaching, let's say, basketball team doing lines, or, a track team doing sprints and things, you could time on your phone or have a specific application to save splits. So those are just some examples.
Or Amanda and Joey, I don't know if I know you've attempted to do some of this through your after school intervention. I don't know if there's anything that's relevant to discuss here or not. I think my sense is that it's just more taking advantage of existing social media to communicate with people, which I think would probably fall under this. I don't know.
Yeah, this Jay, there's like for basketball, there's this thing called Shot Tracker, where they can set up cameras around a gym, and I don't even know. They used to need a bunch of cameras. They probably only need like 2 or 3 now, but it can give you real-time stats for a practice or game. Then like our Sporting Kansas City athletes all wear these kind of bra strap things that have trackers in them, so they can, and the camera set up around the field can track how many miles each player runs and how much time they spend active versus inactive. And those can be helpful because you can rest people when you need to, and you can obviously kind of know how well you're shooting. But then there's also kind of the opposite side of that. Getting a radar gun out for these kids to throw with actually increases the chance of bad elbow and shoulder injuries. So it's got to be done right, obviously. And if it can give tips for coaches on on where to stop people doing bad things, I think that's where it's probably the most helpful. The rest of it's just kind of fun and gets people engaged because people like to know how well they're doing. But that, I mean, that could backfire too. I mean, if someone's shooting bad, it could get in their own head, and they got to know kind of when to turn it off too.
Gotcha. Yeah, thanks for bringing that up. I kind of had forgot about that. So basically they're like performance improvement tools, right? I was in my mind, for some reason, I was thinking about opportunities for sports, but you're exactly right. And I mean, I don't know if you guys have had other interactions with like using it to track like recovery from a workout, or return to play after a concussion, or the NBA, you know, a year ago where they were wearing aura rings on all their players just because they thought they could figure out if they had COVID before they tested positive.
Yeah, I mean, those are all great examples, and so far, no one's come up with a great concussion thing yet. We have like a huge gate lab that we could use to do a few things that are sort of helpful, but obviously you can only use that on so many people at a time, and you got to break down a lot of data with all those cameras to figure that out. But another thing to think about on the technology, which we were just going over, non-accidental violence in sport, and one of the big ones was kind of bullying and stuff that can happen online through social media. So you know, it's really important that kids don't get, you know, the downside to being engaged with so many people about their sport. And someone giving a, you know, high school athlete a whole bunch of crap because they missed a shot and lost the game, that's actually becoming a huge problem, according to some of the kind of non-accidental violence and sport tracking stuff that is out there. And it's basically on the level of you know, abuse. I mean, it's abuse. So.
Hi, this is Anthony. So I think you hit the nail on the head. Like, leveraging social media is really like what we use to promote awareness and participation at this point. And then my general input in this is, you know, we use for adaptive sports equipment, we secure that for the community, like sports wheelchairs and tandem bicycles and things like that, that have really come a long way in the last 5 years. So you almost need to use like the most current version of them, just like mountain biking or anything like that. And we utilize some grant funding through the Nielsen Foundation, as well as individual athlete funding through Move United, to secure adaptive sports equipment.
Yeah, thanks for sharing. And so is it using mostly technology to connect people with equipment, or is it actual technology in the equipment itself?
Technology in the equipment itself.
Yeah, so like I think of this because my neighbors sell these, but like e-bikes, some stuff like that, or is it something different?
Well, that technology does exist for mobility related issues, but not that well utilized. I think the big thing is you need specialized adaptive sports equipment that's constantly being improved, with, you know, prosthetics and sports wheelchairs in general, and then as well as very specific things for like blind low vision participants, like tandem bikes. We've seen a lot of like things that can go off road where typically people haven't been able to access those, because they're extremely expensive, like off-road things. We've seen them come down in price and become a lot smaller and more manageable and economical for an individual to take possession of, as opposed to like a large organization just having one or two of them.
Thanks. That's very informative.
So it's really connecting the participants themselves with existing technology to help them participate in the sport in general.
Thanks. Great. Any other discussion points on this strategy? Very good. We're making great progress. Let's see. Thanks, Bryce, for taking all the notes. One left, is that right?
Yep, one left. Let's
Strategy
see
2.
here. Yep, strategy 2. Sports organizations should establish a regional entity that can serve as a central resource to unify and strengthen stakeholders in the sports sector. So you can see where it ranked here. Fairly middle of the pack for improving health, but we thought that for implementation locally, it might be a little bit more of a challenge.
And I will just say that this came up in a couple different groups I was in the Youth Sports Summit workshop as a potential need for the region. So while you guys vote, I'm gonna, here, Bryce, I can look it up. You can put up the Mentimeter and I'll see if I can find those notes, okay?
Sounds good.
And so it came up in kind of two different discussion points, disparities in access and policies to promote sports. So in terms of policies, I think that this maybe came up with, I think there a couple people have talked about this idea of like a Kansas City Youth Sports Alliance to create comprehensive list to send messages to. So potentially high impact, but hard to implement. And similar for disparities in access, potentially high impact, but hard to implement. And so I think that's similar to what some of our rankings were as well. I believe it got the lowest ranking for able to be implemented locally in our rankings. So I guess I've had discussions with a couple people individually about things like this, who who are players in in this area? Who should we invite to participate? Who might be filling this role already? And the sense that I've gotten from these discussions is that, and someone else said this in an earlier discussion, it's like the wild, wild west in terms of there's not necessarily any unifying body or central organizing organization. I guess, does anyone have any additional information that would maybe, if you have a different perspective? So this is in terms of, I've worked with a couple UMKC professors who do like systems work. And this is one of the things that they say as a sign of a dysfunctional system is when there's not a central backbone or organizing group that serves to connect all the different organizations and players and parts of the system. So I can see why this might be getting ranked high for importance, but there's probably a very good reason why there's not a central organizing body in our region. So does anybody have any thoughts on why this is not being filled in our region?
I think it's probably the bi-state nature of Kansas City is the biggest reason, but yeah, that's all I got.
I also don't think there's funding tied to an organization like this, right? Where does the money come from?
Oh, funding for the organization, you're saying? I thought maybe you were going to say, and I think Jessica maybe mentioned this in our earlier conversation, is that also people are competing for funding at the same time. So there's, you're kind of, you got to get your own, in some ways, your own piece of the pie.
I wonder if all sports see it like it's relevant, like maybe they're interested in, you know, collaborating and having something for like just baseball or just basketball, but do they see how this would be beneficial for kind of connecting all sports? So it might be kind of like awareness of like what folks could get out of an organization like this.
Yeah, maybe Jessica, do you have any experience with that? I know that your organization really, promotes sports sampling and you engage with other organizations to do some of that.
Yes. Do you mean, Robin, specifically to what Amanda was just referencing, or you mean in general, a perspective on just an entity and like this?
Yeah, I guess both, but I suppose it made me think of, what building off what Amanda said around, baseball thinks about baseball, basketball thinks about basketball.
Yeah, I think so yes, I think the answer to Amanda, your hypothesis is, my answer would be yes. I think when you get particularly zooming in on like, depending on who the audience of said sport is, right? If it's like club teams and leagues versus leagues that are operated through a Parks and Rec department. I think just to sort of echo some of the things I said to Robin directly earlier in our conversation to the group here, is like, I think there's absolutely a need for a central organizing group like this. I think the challenge is that, in addition to what Robin already has stated, is the competition piece, but I think we would need to spell out very clearly, like, what is the why? Like, why would an individual or an organization want to be connected to this, and what's the benefit going to be to them? I think if it's anchored around ultimately either increasing participation, which is going to be a universal, I think, goal probably for anyone, whether they're for-profit or nonprofit, connected to this. If it's increasing participation, that's going to be a win-win for everybody. And if there's some secondary and tertiary goals, right, or objectives of the group that are going to be universally beneficial, I think the crux to the success of this, right, is going to be like, the naming on the front end, like what it is not. It is not necessarily going to be something that is trying to create to deepen the competition field for nonprofits who are going after similar funding sources. I think speaking from the nonprofit sector in an ideal world, like that this would be something that would help create efficiencies in the space of youth sports so that there's not duplication in program development or opportunities, so that there's making sure that the needs are being met of everyone in every sector, or all kids, and we could expand it to adults too. But that there's a need for this that's beyond just what's in it for me, I guess.
Yeah, that kind of touches on equity there too, I guess, making
Yeah.
sure every kid has equal or appropriate opportunity for participation.
We really try to serve as a vehicle. So we're not the experts in one particular sport per se, but we're trying to act as the vehicle to bring folks together around sports sampling, around access for girls to play sports, around leadership development, life skills development through that. So if we can find partnerships within the community that holds up the folks who are experts in those areas, like that's the goal for us.
I was wondering if, Anthony, you could just say just a couple words about what I know Whole Person has received some, leads some initiatives to try to, and I'm going to butcher this, so I'll let you say it, but to coordinate some of the accessible sports opportunities. Is that correct in the region?
Yes, so that was the link I shared in the chat, which does this on a smaller level, just with the accessible sports in Kansas City. I think you guys kind of hit the nail on the head. It's like communicating the value proposition to organizations to participate in this, as well as kind of combating the gatekeeping that goes on, because they kind of view this as a zero-sum game, and some resources or knowledge that they give to another organization is or participants are somehow leaving their organization. And so kind of combating that, and just trying to communicate the value proposition of increasing participation across the whole landscape. But we have a lot of challenges.
Yeah, and we can maybe Bryce, we can include his video from his presentation that he gave a couple months ago to the PAPI group. We can include that in our notes, just so people, if you're interested in learning more, Anthony had a really nice presentation. I guess, how long have you guys been coordinating this work around accessible sports?
About 3 years. And so the first year was kind of similar to what we're doing here and kind of identifying gaps. And then we've kind of worked into having a community calendar, and really kind of a directory of local organizations that are providing opportunities. And yeah, I think we've really had a lot of success from like the conservation department that sees our calendar as the way to access the disabled community. And so putting a lot of things on there. I think the challenge is, how do we communicate the value of participating in this to the people that are already doing like really great things? We have a lot of organizations, some of them don't need any help and are doing awesome stuff. And so how do we get them to link up with and share, what they've learned and their expertise to the smaller people that are just starting off. I think everyone understands the value of increasing participation. It's just, how do we do that? How do we promote, sports sampling without cannibalizing anyone's program? And yeah,
Yeah, thanks for sharing. And maybe we can talk more about that, just because you've learned a lot from your work on this already. So, any other thoughts on this? Okay, well, I'm looking at the clock and we're at 2:20. So, Bryce, we got through everything, correct? Great. So the next meeting is, sorry, I think it's October 13th. So we'll stick to the second Wednesday of the month. So Wednesday, October 13th. And what we will do, hopefully we'll get this done with some lead time. If not, we'll just do it during the meeting. Bryce and I, along with Adrian and Bill, are going to summarize all of this information in, like I mentioned earlier, the strategies that are prioritized, and then the tactics within each strategy prioritized. And then we'll also have a little bit of information around, and if you open up, if you go to the full plan for the strategies that already have been created, we also put in there just information about the process that we went through. If you're a local leader, or if you're a member of the community, like a parent, a family, an athlete, something like that, what are some immediate things that you can do to get involved in sports sector. So we'll review all of that at our next meeting. As I mentioned before, if you have time, think about what you'd like to see this group become now that the planning session has been done, if we just go off on our separate ways, or whether we try to do something else. So with that, I'll just open it up to announcements, for lack of a better term, from our participant, or from anyone who wants to say something. And I'll just mention that Adrian sent out a message that their Kansas City United has started their football leagues. They start on the 18th, and they are always looking for volunteers to help throughout the season, and that can be anything from working the chain gang to helping people, helping clean up trash, or just organizing things. So if you're interested in volunteering, let me know, or let Adrian know. I'll put his email in the chat. Does anybody else have any other anything they'd like to mention? I think Anthony put something in the chat, maybe.
Yes, I put that in the chat. It's kind of the culmination of the work you guys highlighted with West Hamilton and Parks and Rec, and kind of raising awareness about the accessibility in our local neighborhood parks. And so the next iteration of that is actually doing programming out of the parks. So a fitness program that should move around to different parks in the city.
Awesome, great, thank you. You should have gotten an email in promoting the weighing in quarterly meeting that we're having tomorrow, because we've got a great speaker. Great speaker. I was just gonna pull it up and I had it closed.
Becky Wiseman.
Yeah, Becky Wiseman, and I was trying to see what her title is, or the title of her talk is.
She's a social worker. She's our sports counselor for Children's Mercy, but she's a social worker by training. But she's been a high school counselor. She's been a sports counselor. She actually now works for Children's Mercy and for Sporting Kansas City. So she's even working with their professional teams. And Becky's just the best. I mean, everybody loves her. She's wonderful. All the kids, plenty of kids come to me and I'm like, you know, it sounds like maybe you do a good meeting with Becky. And they're like very skeptical. And then they meet her once and then they're sold. So she's awesome, but she's got some really good insight on just sports mental health stuff. And I'm not going to be able to listen to it tomorrow, unfortunately, but I've heard her talk before. So.
And we've got the title of her talk is Influence of Physical Activity on Mental Health. And we'll throw some links in that from some things that she's written. It should be a great presentation. That's at 9 a.m. tomorrow. We'll probably be done. We're scheduled to go till 11. We'll probably be done about 10:30 or so. So hopefully we'll see you there. Any other announcements? Great. Well, thanks everybody for your contributions to this work. Bryce will hopefully send out the newsletter update next week, and we look forward to seeing you in October. Thanks all. Bye.
Thank you.
Thanks, guys.
Cool. All right. Nice job, Bryce. Thanks for doing all that note taking.
Yeah, no problem.
It's a lot of work, but
Surprised. Yeah. So I'm going to stop the recording.